So welcome everyone. Thanks for hanging in there in the post-lunch crowd. I know it's always hard on conference days like this with a lot of information. There's a lot filling up in your heads. My name is Heather Eckner. I serve as the Director of Statewide Education and Outreach for the Autism Alliance of Michigan. I have an education background. I have classroom teaching experience. I'm also the parent of 2 children who are on the autism spectrum. I have a middle schooler and an elementary daughter. My son is in middle school. So I come at this experience also as an advocate. So I have worked alongside families, attending IEP meetings and trying to help students and their parents, by extension, have access to the most appropriate services and supports, and looking at increasing the best outcomes that we can get for students in the school system. And I also have experience with both of my children who have received ABA therapy from outside providers. So for our topic today, I kind of come at this from a number of different levels of experience. And I'll turn it over to my teammate.
So I'm Ashley Shader, and my background is in behavior analysis. I'm a licensed and certified behavior analyst in the state of Michigan. I have spent a lot of times in a variety of different school settings across many different states as well. So Illinois most recently, right before coming to Michigan. But those settings have been within the public school system as well as within residential placements for individuals who are adolescents diagnosed with varying diagnoses, as well as within the juvenile justice system too. So I've kind of run the gambit of background within the schools, and I'm very excited to have come on board with the Autism Alliance as the policy manager recently.
Thanks, Ashley. I'll also, you can see kind of what our just 3 main objectives are for the session today, but like everything in related to special education and often intervention, it's an acronym soup. So I'm just going to kind of go through a few top level ones, and then we'll try to make sure we spell out acronyms as we use them as well. But in some of the slides, you'll see most commonly, so let's start at the top, ABA, so Applied Behavior Analysis. And as we're talking about it in the school setting, we'll start getting into some of the special education acronyms. So the federal statute that governs special education in our country is the Individuals with Disabilities Education Act, or IDEA. And IDEA ensures for students with disabilities a free, appropriate public education, also sometimes referred to as FAPE. And I think Eric, even a couple of times in his keynote, talked about FAPE. Yep. The way that you develop then for students who are found eligible under IDEA, the offer of FAPE is written into a document called an Individualized Education Program, so an IEP. For children that are birth through age 2, you might be familiar with an Individualized Family Service Program or Plan, IFSP. Okay, so an IEP is like that school-based plan. We also might talk about the least restrictive environment, or LRE. And I think those are probably the main ones. But so if any others come up, feel free to stop us if we're kind of getting into jargon speak, or any acronyms that we didn't explain, and we're happy to go over those with you all. But we do want to just kind of take sort of a short dive into just what is ABA, and then we'll talk about some of the common pitfalls and myths as we know about them and we hear from families predominantly, but we actually do hear from a lot of educators and providers in the space, because this is, in Michigan, it's just kind of a tricky space to navigate, it seems like, with ABA school. And then we'll talk about some of the advocacy efforts that the Autism Alliance of Michigan is engaged with around this topic. So a quick disclaimer, because we are talking about special education, the system, which is governed by federal statute and regulations. We are both non-attorneys, and so we might talk about particular laws that apply, or specific aspects of the law, provisions of the law. However, it's not legal advice. And certain situations, if you find yourselves in, you may need to consult with an attorney that practices in this area of the law. But we just wanted to make that clear up front. So we may refer to the law, but we cannot give advice on the law. So Ashley, I will turn it over
so
to
we'll
you.
start it off at the top. So what is ABA? So show of hands again, how many people are familiar with ABA? Oh, fantastic.
Good.
So I won't do that big of a deep dive into what ABA is, but within applied behavior analysis, really what we want to see is that we're going in to really understand the environment that that individual is in, so that we can actually develop supports and change that environment to really meet the unique needs of that particular individual. So it's not about like what is happening with that person. That's fine, whatever. I want to know what's going on in that person's environment, right? And then developing those critical support systems in place for that person. So outside of that, we kind of have like a creed within behavior analysis. I like to refer to it as the bat cage, but I also came from a behavior analytic program that was called the BAT. So we were behavior analysis and therapy. So I actually have a psychology background on top of that. And with that, we want to make sure that we are first and foremost behavioral, right? So we are going to actually take an objective look at what is going on. We're looking at those facts. We also want it to be applied, right? That's the whole applied and applied behavior analysis. We want to make sure that it's relevant to that particular person and that we are going to actually impact that individual's life as best as possible. We also want it to be technological, yeah? And really what technological means is that we are writing things out so that somebody else can actually follow the plan that we create and be able to reproduce it. So it's when I work with students, it's like writing a recipe, especially in baking. If you don't follow the recipe, you don't know what you're end up with right at the end. It could be a cake, it could be soup, but you have to follow that recipe to actually get results and the results that you want. After that, so that was the bat part, we have that cage. So we want to be conceptually systematic. And all that means that we have to follow the science of behavior. We want to make sure that we're relying on that research to make sure that we're informing our treatment decisions when we're making those treatment decisions. And then we have the other A, which is going to be analytic. It means we are actually looking at that data and we're making data-based decisions. The G is going to be generative. So we actually want to make sure that we are applying these interventions in a way that that person can generalize those skills anywhere. And that's going to be within their home. It's going to be within a clinic setting. It's going to be within the community. And when we talk about community as behavior analysts, we mean everywhere else that's not that person's home. And that's not the clinic. And that includes schools. Okay. And we'll talk about that a little bit later in some of the definitions that is provided by our state. And then we have that last one, which is the E, and that's going to be that we are effective. So we want to make sure that we're actually looking at the data, that we are making a meaningful impact in that person's lives, and we are adjusting accordingly. But more importantly, we want to make sure that we are taking that individual's culture, their identity, and their values into consideration before we are implementing and creating a plan for that particular person. When we're looking at ABA interventions within school settings, there's a variety of different interventions that we can actually do. And first and foremost, we do have language and skill acquisition. For language acquisition, like a lot of people, especially if you are a behavior analyst, you think of like DTT, so discrete child training. We love acronyms, sorry. So a lot of that table time, and primarily that's a lot of like school readiness, especially at the early intervention level. But we also do a lot of social skills development. And as that individual is growing up, in life as well. We will even teach more like job readiness as well. Activities of daily living, all sorts of things are going to happen in that language and skill acquisition.
Nope.
But more often than not, where you see behavior analysts come in during the school is going to be this second one, and that is reducing behaviors. So we get a call, hey, so-and-so is throwing a desk. Okay, come in and take care of this. So we're meant to come in and kind of put out the fire often within a school setting by helping to evaluate and then develop a plan to help support that individual. But that's not all what we do. We also have to be able, in this same effect, if we're reducing and managing challenging behavior, we also want to be able to have an adaptive skill to replace it. Because behavior ultimately is a way of communicating some sort of need or want, right? So we have to take a look at, what is this functioning as? What is this supposed to mean to me and for that person? So we have to come in and take a look at, how can we teach this individual how to appropriately and adaptively change that behavior so we can help work with them a little bit more. So a lot of coping strategies and a lot of self-management strategies also fall in line with behavior reduction.
Just look at the way.
I know. And we also do a lot of classroom management approaches as well. So one knows and is probably familiar with PBIS. Right? So positive behavior interventions within schools. Right? So there's a tiered level of supports. A lot of that often is with classroom management procedures. Those are behavior analytic and their foundation, but there's a little bit more that we can do within classroom management as well. A lot of classroom-based incentives, a lot of like group work that we can do with an entire classroom. I was brought into a public school classroom to help with like one 12-year-old. And even just working with this 12-year-old who is like diagnosed bipolar and also like ASD, and I was like, how is this even happening that you're being diagnosed bipolar at the age of 9? I have questions for your psychologist and psychiatrist. But the teacher found it so useful with what I was doing with that particular student that she was like, hey, can you actually help me with my entire classroom? It's like, yeah, let's do this. So we can set up a classroom management approach as well. And then the last one, and this gets missed sometimes, is that we can actually do enhanced trainings for those school personnel. So being able to come in and give them valuable tools and techniques to be able to like help them. We want to make sure that their lives are easier. Being a teacher is hard. You have to be able to manage like 30 children that need you at any moment's notice while getting a curriculum across. And then you have these other professionals coming in and be like, actually, I also need you to do this, this, and this. But being able to come in as a behavior analyst, we can be able to actually help in training and be able to work things into the things that they are already doing. So we do have a common challenge, and one of the biggest examples that I've heard, and we kind of heard it a little bit in here as well, is that let's say we have, I'm going to give an example from my own experience. It's like I'm coming into a public school as a BCBA, and in that school setting, I'm working in a classroom. There's several students in need of evaluation and a plan to help support them. And the principal comes to me and says, you can't actually provide service for this particular child or any on an individual basis. You can only do classroom management procedures. Because if we provide that service for one student, I have to be able to open it up to all students. What? So this is, again, for students who need that unique support, right? Doesn't mean that every person needs ABA services. But when that principal left, a new one came in, and I got a contradictory statement. No, you are more than welcome. Actually, we desperately need you to come in and help assess and provide behavior intervention plans for our students. Great. I have a whole team of students who will come in and help support your school. And ultimately leading to actually getting grants to be able to go into our public school systems in a very rural area, the Upper Peninsula. Mm-hmm. So I think for the past, just tramping around the snow. But so we see that common challenge of these contradictory statements. One area is allowed to have behavior analysts come in, others are not, only in certain capacities, but not in others. So we see this as being a huge issue.
And also, you're not allowed to say snow again.
No more snow. But they still have
no, don't say
6 feet of snow.
So we know that, as in the last example that Ashley just gave, we know of examples where schools do allow outside ABA providers to come in and provide services to particular students or even classrooms sometimes, depending on the need. It's often done quietly, and in part it's because there is a lot of confusion about just what is allowed, what isn't allowed. There really aren't any formal kind of set policies in place. And so what this slide, I know it has quite a bit of content on it, but what we started to outline here kind of is the current landscape in Michigan. These are aspects that are pulled directly from state level policy guidance documents. And so if we kind of walk it back to, there's the federal statute, IDEA, which mandates what happens under, the provision of special education in public schools. And then each state is responsible for administering the federal statute. And so states will develop their own administrative rules. So in Michigan, our collection of those administrative rules is referred to as MARS, the Michigan Administrative Rules for Special Education. And then beyond that, there can just be sort of like policy guidance, right? So there's the what you have to do, but there's a lot of room for interpretation in that. So if we actually go back to IDEA, what is required when a student is found eligible under IDEA is for the public school to provide a free, appropriate public education. That's a lot of ground to cover in terms of determining what constitutes that appropriate part of the education. And parents are granted rights to exercise on the student's behalf under IDEA. Parents are equal members, required members of the school team. Parents are part of that decision-making team and process. You may not always feel like an equal team member, but you are. And so you're part of the group that's determining what is appropriate based on the unique needs of that individual, your child, that student. And so as we kind of go through then the process of this, there has been some policy guidance that has come out from our Michigan Department of Education. And those first two lines that talk about ABA up at the top is pulled directly from some of their communications that have come out. So if the IEP team discusses what the needs are of the student and determine that ABA is a necessary service or support, it can be written into the IEP, and it should be included in the section that's called Supplementary Aids and Services. And so this is something that the team can agree upon. If and when that is agreed upon and it's written into the IEP, the school is responsible for delivering that service. Now, that can look a lot of different ways. So in some school districts, there are districts that hire and have on staff BCBAs, people qualified to the level that Ashley is to deliver that intervention. There are also school districts that cannot find a BCBA in their area. They do not have qualified school staff. If that's the case, the school can then contract with outside providers, right? Where we start to get into even more kind of challenging situations are whenever areas of agreement start to break down. And, you know, maybe the parents are asking for their outside provider to come into the school setting because the school's saying maybe they don't have it. Or the school team might be saying, you know they don't have it, and they might say it's just not necessary because, you know, kind of in the back of their minds, they're like, how are we going to do this, right? And so parents will often, if they have outside ABA, they'll say, well, why can't my BCBA come into the school and help in that case? And this is where we have a whole, I mean, pretty much the whole continuum of what can be possible. We have some schools that, like I said, will kind of quietly do this. I'm going to just share with you all that my son, whenever he was in elementary school, we worked with an outside ABA provider group, and my BCBA came into the school. We never wrote it down. It was discussed at our IEP team meetings, and it worked because, you know what, that didn't rock the boat. But is that what's right for all students? You know, like, we don't kind of have formal things in place that, so they had a knowledgeable parent that knows how to ask this, knows how to negotiate and kind of navigate like this whole complicated system. And yeah, it works out for my one kid, but it's not working out for the other kids who need access to services and don't know how to do this, right? Like the way that I did. So we know that this happens. And so something that the Autism Alliance of Michigan has been working on at a policy advocacy level is having these hard conversations and connecting with educators in the classroom, administrators in the districts, saying, we know this is a challenge for you. We want to work together. We want to collaborate on, you know, innovative solutions so that what are the win-wins we can find in this? And we started to make some really solid ground in like the fall of 2019 and into 2020. On the Medicaid side of things, we started to find that Medicaid providers were starting to say that, you know, this is an allowable service. It will be covered under that, and including in like school time for that. The Medicaid school-based services coverage rolled out the Caring for Students, which Ashley had mentioned. And we thought, oh, great, like schools are going to embrace this and be able to do this. And what we found is that often with certain policy change, the implementation sometimes kind of, you know, falls off, right? So as we looked at implementation, we're like, well, why isn't this happening as much? And we had lots of meetings and people were saying, well, we don't really understand, or we can't find people. So then we keep coming back to like, well, we have a pretty robust provider network in the state that of outside community-based providers that are able to deliver this service. You know, how can we hook you up with them and kind of connect you and help this out? And we kind of keep coming back to some kind of barrier that hits around schools kind of being reluctant to just sort of put something more formal in place to allow more kind of crossover between systems and between settings. And so that's something that we've been actively working on. What we hear a lot from schools, kind of captured in this bottom rung here, is there's a concern about, you'll hear supplement versus supplant as two words that come up a lot. You know, like nothing from an outside service provider should come in and replace supplant, right? Shouldn't replace it. How can you supplement what's happening? And so those are some of the conversations that we're having. So this slide isn't necessarily showing you a solution for anything. It's kind of showing you a current snapshot for where we're at, sort of at that kind of policy and like regulatory level for things. And, you know, if it's not written in the IEP, the school doesn't have to do it. So that's where the challenge comes into play of having more formalized policies in place, because what parents don't know, I know it was either this session or other sessions I've heard where parents are like, how do you know about these things? Like, how do you even know to ask for these things? So we want to keep working on building that knowledge base as well, so these conversations can be had at the IEP table. There's additional information here that just kind of talks about, you know, some of the thinking behind like the belief that, you know, families should identify the providers with flexible hours and kind of stack the services.
Right.
Right. Go, you can take it.
Yeah. So like, and what kind of gets me at this too is, all right, so we have a student who is in school for 8 hours a day. And then, because most, especially early intervention for applied behavior analysis, if you really want to see large gains and big outcomes, the typical recommendation for an individual with autism is between 30 and 40 hours a week. Where does that come from? So we have these kiddos going in for 8 hours a day for school. And then you're supposed to then take them for how many more hours for services? And that's not just ABA services either. That is OT, PT, SLP, and any other services that individual needs at the same time. And some of these, there are like push-in services within the school, like OT, SLP, things like that. But you don't often get maybe as much as that individual needs, and you still have to supplement it outside of the school as well. But yeah, find providers that have flexible hours, which means that providers are often working until 9 o'clock at night, me being one of them, to be able to provide individuals with the necessary services that they need to be able to actually gain access to their education. And where we can work together and actually integrate those services so that person is able, in the moment, be able to actually grasp and utilize that education to the fullest extent possible in that actual setting.
Right. You know, I just noticed this slide is pretty heavy on the acronyms. So I just want to do an acronym check and make sure and AIB is the autism insurance benefit. That was one we didn't cover earlier. And I think the rest we kind of, MDE OSE is the Michigan Department of Education Office of Special Education. So when I say, you know, this is pulled from policy, guidance, documents, communications, that's the office in our state that is putting that out. And then if you look at that very last sentence, this is kind of what we're talking about too. And another person saying that like their child goes to school for half a day, but then an ABA clinic for the other half of the day. And some parents might hear that and think, well, now how did you make that? How did you get that to happen? Because my school team said no, that's a violation of faith. And this is another example of where even within the same school district, even within the same school buildings, we have heard 180-degree kind of experiences. I've worked with families where they've had two different experiences within the same school building. One says okay, one says no, and parents are just really confused and left sort of bewildered. But there is often pushback then, you know, parents will want ABA provision, in school team says no, and they say, well, I have an outside provider, can I bring them in? School team says no. And then they say, well, then can I pull my child out, maybe 2 or 3 half days a week and take them to the clinic because they're making so many gains there. I think it's going to help them overall. And it kind of depends, right? It's if the IEP team agrees, then it can be allowed and it's written in and explained in the IEP. If they don't agree, then they'll often say it's a violation of faith. But like I said, we have examples of it both happening. And this isn't to kind of pit families and parents against school team members. We at the Autism Alliance, we have educators reaching out to us all the time saying, I don't understand, can you help us? Like, what's happening? So there's just a lot of confusion in our state around all of this. And it's not like this everywhere.
No, it's not. So really, when we're going to take a look at making ABA intervention more accessible, we have to start where we kind of are and meet people where we are right now. And kind of teach people, especially family members, to advocate for their loved ones' needs, right? So making sure that you have that collaboration during IEP meetings. And providers often get siloed, so we don't get to talk to each other a lot. And when that happens, there tends to be a disconnect and really disjointed plans that are in place to support this individual. So collaboration and having that transparency is key. So even if that behavior analyst isn't coming in to the school to provide services, at least getting them into the room where it happened. So I'm going to do like that Hamilton quote, right? Be in the room where it happened so that they can inform even the services outside and help collaborate with each other. And that's where dialogues can happen. That's where like we can drop egos too and work together and collaborate and they can actually see the benefit of having this collaboration. And hopefully we can like then squirrel ourselves in and be able to work more directly with that student within the school system. So really looking at collaborating during those IEP meetings and remembering that that IEP meeting can be called at any time too. Don't wait for that year to be up to have the conversation. You want to have the conversation with them every month? Great. If you want to meet with them every week to make it happen, cool. So I do tell families, like, don't be afraid to kind of like roar sometimes, because it is that person who is going to be negatively impacted if they're not getting the services that they necessarily need. So looking at that. But the other aspect that I really like to come at it too is that it really reduces the burden on teachers. Remember, I like pointed out earlier that teachers have a lot going on. They're managing an entire classroom. They also are trying to coordinate a bunch of other things for these students that we're working with. And being able to have that behavior analyst come in, as well as maybe like the registered behavior technician, which is kind of like that paraprofessional aid, if they're able to come in and work directly one-on-one with the student too, that really eases the burden on the teacher. They're not having to deal with like the data that we need to collect. They're able to do that one-on-one redirection of that student when it's necessary and when it's needed. It's not, behavior analysts aren't going to necessarily come in and like take over the classroom. And that's sometimes what is feared, is that a lot of schools think that we're going to come in and just like judge them. And that's not the point. The point is being able to provide services for that student so they are supported and they can be successful anywhere in their life.
Then we get into advocacy, which is when I break out and smile. So advocating for a child's education rights is challenging. There's just no way around that. It's not an easy road. But there are some key principles of IDEA to keep in mind, no matter what our current landscape is, because here's where we are, and this is where we have to start, right? But two of the most powerful in IDEA are parent participation and the procedural safeguards. And so there are federal regulations under IDEA. Procedural safeguards is actually its own specific subsection, and it affords particular rights on behalf of parents for the students. And it affords them kind of a path that they can follow for handling disputes and how to resolve them. And so that's something that any parent should receive the notice of their rights and the information on them anytime upon the first initiation of evaluation for the initial first IEP, at least at every annual IEP meeting. So hopefully if you are a parent in this room of a child with an IEP, you have at least been familiar with or been given, or someone has told you about this, because parents often say, what are my rights or what are my child's rights? It's that's where it lays them out. So if you want to know what those are, it's not easy reading. It's not fun reading. It's not a John Grisham novel, but you got to tuck in and work through it and get your highlighter and your sticky notes and try to do that, because that's where all the golden nuggets are found. So that's one of the best advocacy tips that I can give you in terms of how to empower parents, whether you are a parent or you work with parents. It's important to empower parents on behalf of kids' education. And so then just some other tips. Advocacy really is about the knowledge of what to do and what to ask for and how to ask for it, right? And so one of the foundational tips is make every request in writing. You always want to have documentation, kind of keeping your record. It's fundamental as part of kind of clearly laying out what your child's needs are. It's an opportunity for you to share outside evaluation results and reports, but you always want to have captured things in writing. Email works, it counts. And as Ashley mentioned, you can request an IEP meeting, team meeting at any time to discuss the concerns. I already mentioned that parents are equal and required team members. The key term there is meaningful participation in this process. So, what the school team needs to consider are parents' concerns and requests. And, you know, just hearing them, it's kind of a question of, is it meaningful to just be like, yeah, I know you asked for that, but like, what, you know, can we discuss it? Can we really talk about it? Can we work at collaborating? The whole idea and concept of that IEP team is to collaborate within the best interest of that individual child. So as much as you can bring it back to that and say, how can we work this process with that North Star in mind? It's going to keep moving you forward towards a better outcome. And familiarizing yourself with this concept called PWN, prior written notice, which is located in those procedural safeguards. And prior written notice, we could do a whole session just on that. But what I can, and I think these slides will be posted afterwards whenever we put up the recordings. But I see some people go ahead and capture a picture too. But this just gives you a little overview of what prior written notice is. As a parent, you should always be receiving it before the school takes any kind of action in terms of identification, evaluation, the educational program offer, and then placement determinations. All of these things are supposed to have a notice element with it. Prior sometimes gets a little confusing. It doesn't always happen what seems like before. So some of it does, like the notice of an upcoming IEP meeting, right? That comes prior. But when you meet and discuss at that IEP table and whatever determinations are made to do something or refusals, so that's where it's key. It's whether the school is going to do it or if they refuse to do something that you have raised and requested and have discussed, you are supposed to receive written notice. Okay, so sometimes it comes after the meeting, even though it's called prior written notice. That's why. So it's almost like forget the prior part, just written notice at all these different points along the way. And you kind of can see some examples there. And then written notice really should have 5 elements that address it. So what I'm offering up as an advocacy tip is if you are in a situation or you work with a family that's in a situation, empower them to make written requests about what they think, you know, they want to discuss or what they think they want the team to consider that are in the best interest of the child. And if the school does not agree to it, make sure the parents understand that they're supposed to get written notice, giving a cogent rationale for why. Okay, and this is important in that documentation piece in terms of how you can continue to exercise like the process for figuring out, well, then what are next steps, right? And so I know we don't have enough time today in this session to really do a deep dive into all the different ways that advocacy can inform just your approach to this. So what I did is, this is a guide that I actually drafted this. It's a very basic outline of just fundamental advocacy. And all of our navigators have a link to this guide. We sent this out in our My Navigator newsletter at the return of school in fall of 2020. But unfortunately, COVID still applies and kind of nothing has changed, either in terms of the obligations of school districts under IDEA since before COVID, nothing was ever waived. And we're still kind of in COVID mode even now. And so what I would say is reach out to the navigators and request this guide, because everything I just talked about with advocacy and some more is laid out in this in just like all of 5 pages for you. So it's a pretty easy way to kind of walk through it or share it with any families that you work with. And so then kind of moving on with like this back end of the talk as we sort of wind things down, we're now looking at like, where are we going? What is the advocacy work of the Autism Alliance of Michigan? And if you kind of have seen the picture that we've woven, what we're working towards is fuller systems integration. Like, how can we figure this out so that it is more seamless and it doesn't feel like there's these like kind of separate pieces and parts of kids' lives that aren't connecting to do what is best for their fulfillment, right? And so we are convening Grasstops and grassroots efforts. We're really aiming towards, removing barriers to access and opportunity. You can kind of see sort of the main aims of what we're working towards with this. Even though we've been working at this for a while, we're still kind of in beginning stages. I don't know if you want to add anything to that.
No, I think that's it.
Yeah. And so, it's one of those times where we kind of don't have the like, aha, here's the solution, because this is a complex problem. And it's a problem though, across our entire state. but it's really impacting educators, it's impacting families. So we've identified it as something like we've got to figure this out, right? And so that's our commitment, is that we're working towards trying to find solutions that will work for everyone. And so just to kind of give you a quick glimpse of what do I mean by Grasstops and grassroots, when I first started hearing everybody using Grasstops, I'm like, what's going on? All this lingo in the space. But Grasstops is that leadership level of bringing together, you know, people from the State Department of Education, our State Board of Education, you know, labor unions, administrative groups in the education space, statewide organizations like ours, and we convene the Special Education Coalition of Michigan, which we started in 2019. And that group meets monthly. We've been convening regularly monthly, and we have strong engagement. Everybody shows up. So in that way, it's a very positive note that, you know, we have MDE there at the table talking about these issues, and with us every single month, we're trying to work with them and through this. So we're using that as one vehicle, but we recognize that, you know, you can only kind of get so far sometimes with just one approach. So our grassroots effort is the Michigan Parent Advocate and Attorney Coalition. And this coalition is our grassroots community organizing effort. We're really about knowledge building and sharing, co-designing, trying to really identify key priorities that are affecting students. So it's a very student-centered approach. And we're looking at collective impact. So how can we come together to change things within the system that will benefit all of our students with disabilities? We are autism-led, but this is a very across disability effort. And so there's a little bit more information here about MyPAC, because that is something that we're really encouraging. You know, if you're a parent or if you work with families, please let families know about this. It's a place where we can all come together and like I said, kind of share what we know about what's happening. We report out at a state level about what's on, and then we're talking about what's on the ground, like the ground level. And so we're really looking at, you know, access to equitable opportunities. We want to see educational benefits, and we want to drive systemic change. And so we really are trying to get the word out and grow that group. I think we're currently across the state at around 115 members and growing. So we welcome you to join yourselves or to share that information with others. So I know that it kind of feels like one of those abrupt things of like, we don't have the solution now, we're working towards it, but we're happy to try to field any questions you may have.